For all the details on what happened to me regarding my injury, we're pushing 100 hours plus video now. YouTube channel, My Medical Nightmare. New review out on Vulcan Imaging Associates. Located at 3300 Cahaba Road, Suite 300, Birmingham, Alabama 35223. And this is dated July 16th, 2026. This patient writes, had a mammogram in March. Kept receiving threatening texts because there was supposedly a balance due for the radiology part of a mammogram. I never have a radiology charge due to my insurance covering wellness. I contacted Vulcan and they had never filed it with my insurance. Forward to July 16th-ish. Started receiving messages again. Contacted Vulcan. They stated that my insurance had paid them in June but took it back. I contacted my insurance company and explained what Vulcan shared about taking it back. My insurance then contacted Vulcan and we had a three-way call. Vulcan received the money and there it was clarified that Vulcan had received the money in June and closed the account. Not sure what is going on with Vulcan, but sync up your medical bills with your insurance account before you pay anything to them. If you only had to deal with Vulcan Imaging Associates and had a billing matter, you might have made off pretty good as a customer and patient, because what happened in my case is I was misdiagnosed and I almost died because their doctors told me that I had no injuries present, despite the fact that I did. Yeah, my experience dealing with Vulcan Imaging Associates and reading about others' experience is they will do and say anything to get your money. And once they got it, they will not speak to you. Their tactics involve targeting affluent communities, subdivisions, neighborhoods, around Birmingham, Alabama. They'll go into an area such as Mountain Brook or around the vicinity of the Greystone neighborhood up on Highway 280. They'll sponsor events in these areas. They're interested in clientele who have exemplary insurance, like a lot of corrupt doctors. Once they find security in well-paid insurance, they'll leech on. Vulcan Imaging, they regularly reply to reviews and complaints, but the reality is this is simply a token or a procedural issue. Whenever you call the number or attempt to communicate with Vulcan Imaging Associates and the discussion starts to lean toward culpability, liability, or responsibility on the part of Vulcan Imaging and their doctors. As you'll hear in my own recorded call at the end of this video, they'll start making up lame excuses and eventually hang up on you. I was a patient and customer of a Vulcan Imaging Associates doctor, and I'll go into my own situation with what happened to me. I had an MRI of my head handled by Vulcan Imaging Associates and St. Vincent's in Trussville, now UAB, in 2019. In my own scan, I was told I had no injuries. I knew better because I was close to death. Almost died from this. Went and got those pictures. I'll put the pictures up here in this video. As you can see in this MRI, I've got about 6 inches diameter infection inside my head. Vulcan Imaging Associates neuroradiological specialist doctor Michael Brandt Ruff, MD, went to school for 10 years to do his job. And he wrote in my records and report, which you can see in this video also, I scanned these in. He said I had no injury present. And so this created a very uncomfortable situation that has yet to be resolved and is outstanding as of this recording, April 4th, 2025. Took these issues to basically all concerned, and they all refused to correct their error, admit their mistake, do a reread. Oh yeah, and they sent me a bill for this MRI, and it was somewhere north of $600. Interestingly, Vulcan was working with St. Vincent's Ascension, who did the scan for me. On November 1st, 2024, Ascension sold this location and 5 other hospitals to University of Alabama at Birmingham, and this whole system has been rebranded UAB St. Vincent's. Why did Ascension sell and leave the area? My story is definitely something that the public needs to be aware of, because the practices that were allowed to occur in the St. Vincent's hospitals and medical facilities were probably enough to shut this place down. Just a personal perspective, my injury and all the complications, my own issue is worth several $millions. Alright, so today we're trying to follow up on the Michael Brant Ruff MRI that I had done in 2019. I was referred to this scan by Northside Medical Associates nurse James Frankie Crum. This is now Complete Health, owned by Pharaoh's Capital. This is located off of Happy Hollow Road, Trussville, Alabama, headquarters in Pell City. Michael Brant Ruff is a doctor who read the MRI for St. Vincent's Ambulatory Healthcare Network, LLC. That's Ascension. If you're following my documentation, you'll note here that in Birmingham, Alabama, we got a real big problem with responsibility, accountability, and radiology. And this week I talked to the 2 main radiology companies in Birmingham, Alabama. And I recently spoke with Doyle Stewart, CEO of Birmingham Radiological Group. According to their website, they have 38 radiologists who work with them. And here in this call, you'll hear me speaking with Kim Mooney. She is the administrative coordinator at Vulcan Imaging Associates. And she states that they have 37 radiologists who work with them. So if you got radiology issues, you go into a medical practice or hospital, doctor, you have an x-ray, MRI, CT scan, these are the types of doctors, and these may be the actual doctors who will be looking at your scan in the Birmingham area. And yeah, according to my findings here, not very reassuring. If your scan is misread, you discover this and you try to seek a redress on these misdiagnosis issues. Not encouraging, my experience here.
You have reached Vulcan Imaging. Vulcan Imaging, this is Kim.
Yes, ma'am. I called last week. I was trying to get in touch with one of your radiologists, Dr. Michael Brant Ruff. I had an MRI scan that was looked at by this doctor in 2019. I got a report with his signature on it saying I don't have injuries. However, in the MRI images themselves, I have evidence of a very serious head trauma-based injury. And yeah, I was told last week that you guys would try to have this doctor get in touch with me, so it's been about a week, and I just wanted to see what the status of that was.
Okay, so I did look into this, and based on, I mean, there's not anything else we can do, so there's not anything that Dr. Ruff can do to assist you with that, since the report's already been read. So there's not anything we can do.
Well, I beg to differ. This was a $700 MRI scan. This doctor was paid to have this scan looked at, and he did not note the injuries. So he is at fault. And so is Vulcan Imaging.
We stand by that report 100%.
Okay, well, the report is in error 100%, ma'am. Can I speak to somebody in management?
Yes, sir. I am the practice administrator.
Okay, can I speak to the head of the company?
Let's see.
Who's above you?
The chairman of the board.
Okay, well, I need to speak to somebody in authority because you're in error with your statement, ma'am. Not professional.
I am so sorry you feel that way, but we stand.
Well, it's not how I feel. It's the facts, ma'am.
Well, now, if you're what you're stating, we would respond. Maybe you'd be consulted an attorney to have.
Well, I mean, if I can't speak to somebody on the telephone about this, I'd be happy to come clear it up in person.
You're more than welcome to come up here and talk to whoever you need to talk to.
This is a serious issue.
I understand that from your perspective.
Yeah, your excuses aren't going to cut it either, ma'am.
It's not an excuse, sir. I really don't know how to help.
What you should do is, okay, you're in business, all right? Well, you have doctors who went to school for 10 years. They're millionaires, okay? They're reading radiology reports for hospitals and other doctors, okay? What you need to do is you need to have them do their job correctly. And if they miss major injuries in patients that they almost died from, such as myself, you need to simply make an attempt to correct this error. Now, I could get in touch with Dr. Michael Brandt Ruff. I could supply my records. He could look at these images again, and we could clear this up in a few minutes. Could I please talk to him?
No, sir, I can't reach out to Dr. Ruff. We don't consult with patients.
That's a very sorry excuse, ma'am.
I'm so sorry. That's our policy. Let's see. What can I do to help you? Let's see. Eric Blackman is my CEO.
Well, I mean, why are you mentioning his name? Why don't you just connect me to him?
He's not in the office.
Well, that's pretty convenient, huh?
Well, it's the truth.
Well, I don't believe you.
I'm so sorry about that.
Yeah, me too.
Let's see. What I can do is I can give you. Let's see. His direct number is.
How many radiologists work for your company, ma'am?
I have 37.
So you have 37. Why don't you take this scan, call somebody right now, and have them look at this scan and correct this issue for me?
But that is not how radiology works. We can only
Yeah, you're not professional. We've already established that.